beautiful Sunday morning mga kasangbahay and welcome to Doctors on TV. And we appreciate your continued support to our program. Just stay tuned mga kasangbahay because we have an interesting topic na maaaring makatulong sa karamihan na nakakaranas ng isang uri ng medical condition, particular sa bahagi ng ating abdomen. Ito ay ang gastric ulcer. And before we proceed to our topic for today, I would like to invite everyone first to follow and like us on social media accounts. Please like and follow our Facebook page at Doctors on TV and like and subscribe to our YouTube channel. Just type youtube.com/@doctorsontv. You can actually send questions and comments sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends. And we humbly let our viewers to keep updated dahil mas mainam ang may alam sa mga bagay na karaniwang hindi natin napapansin. Please stay tuned. We will be right back after the short break.
Tulad ng ibang karamdaman, dapat nakahanda tayo sakaling magkasakit ng COVID-19. Ito ang mga dapat isama sa COVID-19 Home Kit. Thermometer, oximeter, pain relief medicine tulad ng paracetamol, gamot para sa dehydration, disposable face masks, sabon at sanitizer, disinfectant spray, disposable gloves. Para sa iba pang mahalagang impormasyon, manood ng Lifesaver dito sa UNTV, your public service channel.
Mga pagkain na makatutulong magpalakas ng immune system, kamote at talbos ng kamote. Ayon sa WHO, mas madaling kapitan ng COVID-19 ng taong mahina ang immune system. Kaya payo ng DOH, kumain ng prutas, gulay at root crops para mapalakas ang immune system. Ang kamote at ang talbos nito ay dalawa sa mga inirekomendang pagkain ng National Nutrition Council. Ang kamote ay isa sa mga pagkain na may pinakamataas na vitamin A. Ang vitamin A ay nakatutulong mapalakas ang immune system, labanan ng impeksyon at para maging malusog ang respiratory system. Ang kalahating tasa o 100 grams ng kamote ay sapat para mapunan ang kailangan na vitamin A ng katawan sa isang araw. Ang talbos ng kamote naman ay nagtataglay ng iron at polyphenols na makatutulong laban sa impeksyon. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Ang paggawa ng mga kantang papuri para sa ating Panginoon ay pagpapakita ng ating pagmamahal sa Kanya. Manood po kayo ng A Song of Praise Music Festival every Sunday, 7 p.m. here on UNTV.
Different medicines are invented to take care of our heart, but still, laughter is the best medicine. Why? A good laugh causes the tissue of our blood vessels to expand. It could increase blood flow by 20% throughout the body. Stress, on the other hand, constricts our blood vessels and reduces blood flow. Laughter makes our heart's job easier. Try to laugh more often. For more healthcare tips, watch UNTV, your public service channel.
And we have here today our guest doctor, Dr. Frederick Leelin, a gastroenterologist from Makati Medical Center, to elaborate and for us to be able to understand more our topic today. Hi, Doc Freddy. Welcome to Doctors on TV.
Hi, it's my pleasure to be here.
Yes, Doc, thank you. And ito nga po pag-uusapan natin ng tungkol sa gastric ulcer, no? But, of course, siguro maganda magbigay tayo ng konting background on the anatomy and physiology ng stomach. Okay, so para mas maintindihan ng ating mga viewers what gastric ulcer is.
Well, very briefly, and it should be easy to understand, the gastrointestinal tract actually starts from the mouth and it ends with the anus. No? That entire tract is known as the gastrointestinal tract. But today we're going to be discussing the initial part, which is from the mouth, the esophagus, followed by the stomach, and then the beginning of the small intestine.
Yeah.
That's known as the upper part. Okay? And that part is really to initially digest the food that you will eat, and eventually in the lower parts, wherein you will get the nutrition, and in the lower parts, which is already the lower part, or the colon, that's where you start producing the waste product from what you ate. So the upper part is really just the initial digestion.
The digestion. And then the second part will be for the absorption.
Correct.
Yeah, okay. And then yun nga po, sabi nyo, yung last part would be for the waste product production. Okay.
Until you put it all
Yeah,
out.
and then here, dito po, pagdating sa stomach, okay, so with regards to our topic today, which is the gastric ulcer, ano po, usually, paano po nagde-develop? Paano po ba yung gastric acid secretion dyan? Kasi may kinalaman po dito sa gastric ulcer yung acid production, right, Doc?
That's correct. Acid is produced in the stomach and solely in the stomach, no? We call them acid-producing cells. And that acid is the primary factor that will start and will eventually digest the food that you eat.
Okay.
So it's necessary. Everybody has acid in their stomach. Now, the topic being gastric ulcer is sometimes, and we'll discuss it later, there are certain reasons or factors why that very acid na ginagamit natin na pang-digest ng food will now become sort of like our enemy, creating what we call simply an ulceration, or in Tagalog, sugat.
Oh, okay. And ito nga, Doc, so nabuksan nyo yan, bakit nga po nagiging some sort of enemy na ngayon yung gastric acid? Kung baga, kaya nangyayari sa ibang mga pasyente ay more than performing its function para ma-digest yung pagkain, okay? So nangyayari, nagkakaroon po ng sugat dito sa loob ng stomach.
Basically, there are just two general reasons. One is simply napakadami ng acid.
Okay.
It might be a very familiar term that people will say, no? The term hyperacidity. Hyper means hyper a lot.
Yeah.
Acid, a lot of acid. You just are producing way too much acid in your stomach that it now is able to, and the second reason being, overcome the defense. So the first one is you produce too much acid. The second reason is the acid, which could be normal in amount, has overcome the defense of the stomach. So if you have those two factors, too much acid or the defense of your stomach becomes weakened, then you can now produce what we term now as a gastric ulcer.
Okay. And usually po, once nagkaroon na ng gastric ulcer, ganong katagal yung time frame na pinag-uusapan natin before a patient, okay, complains of the manifestations of a patient which has or who has a gastric ulcer?
Okay, if you followed what we said earlier, no, gastric acid is normally produced in everybody's stomach.
Yeah.
So the time frame of producing an ulceration can be short, like a few days to a few weeks, and it can sometimes be over a prolonged period because acid is constantly being secreted. So pag may acid doon and it causes a problem, you can have the symptoms of the disease of gastric ulcer for months.
Okay.
No? And you can also have it in just a few days or a week. And sometimes the ending of that, the gastric ulcer, is bleeding.
Oh, I see. Okay. Now, Doc, say for example, you mentioned about a patient having hyperacidity. Okay, so ano yung difference na, like, di ba, usually marami po nagko-complain na, naku, sinisikmura ko, ang happy ng sikmura ko, para akong may feeling na nagsusuka ng acidic substance. Okay, so does it mean na kapag ganito yung manifestation ng isang individual ay may gastric ulcer na siya, or just basically masyado lang mataas yung acid production in his or her stomach?
When you talk about having a gastric ulcer, at the risk of being technical, no?
Yeah.
The way that you can say somebody has an ulcer, no, is only if you look inside the stomach. And we'll be talking about that in a while, no?
Yeah.
We have an instrument, it's called a gastroscope. We insert it through the mouth, go down the esophagus, then we go into the stomach. And there only can we see a ulcer inside the stomach. That's the only time that you can say that a person has a gastric ulcer.
Oh.
Before that, they may complain, as what you were asking, about usually pain felt in the middle of the gut, right here. It can usually come at the nighttime, you know, when you're sleeping. It usually is sometimes relieved by food, you know, and sometimes it's intermittent and related to some medicines that you could be taking some medicines. And when you have that, we call it, well, simply we call it, you have hyperacidity. And only when you look inside and you see that there is in fact a lesion there, that's the time that we say that you have a gastric ulcer.
Okay, so ito mga kasangbahay, kasi di ba lagi pag merong sinisikmura, sabihin, naku, may ulcer ako. Laging ganyan natin sinasabi. So, we heard it from Dr. Leelin, ano, very, very clear niya in-explain. So, basically, magkakaroon lang ng final or definitive diagnosis of gastric ulcer if masisilip po, no? And yun nga po mga kasangbahay, mamaya po ay kakausapin natin ang ating pasyenteng tinutulungan po, ano. But in the meantime, let's have some tips from nutraceutical practitioner here in Naturally Yours.
Good morning, Doc Sara. Also sa lahat ng ating mga kasangbahay na palaging nakasubaybay sa ating programa. To relate on our topic ngayong araw, alam nyo ba na noong 2020, itinalaga ang second week of March as Philippine Digestive Health Week. Ito ay upang ma-intensify at mas mabigyang atensyon ang pagpapahalaga sa ating digestive health. Dahil ayon sa census, ang mga sakit o komplikasyon kaugnay sa digestive tract ay isa sa mga nangungunang dahilan ng kamatayan ng ating mga kababayan. At isa sa pinaka-common na sakit sa tiyan nating mga Pilipino ay ang stomach ulcer. Kaya naman napakahalaga na malaman natin paano nga ba maiiwasan ang sakit na ito. At sabi nga nila, you are what you eat. Kaya upang maiwasan ang pagkakaroon ng ulcer at ang mga kadahilanan sa likod nito, ang aking ibabahagi sa inyo. Ano nga ba ang ulcer? Ang ulcer po ay sugat sa loob ng ating tiyan. Alam niyo po ba na ang pangunahing sanhi ng pagkakaroon ng stomach ulcer ay bacterial infection? Ito po yung tinatawag na Helicobacter pylori or H. pylori bacteria. Ang mga pagkain po na dapat nating kainin upang makaiwas po tayo sa pagkakaroon ng stomach ulcer ay ang mga pagkain na mayaman po sa antioxidants. Dahil nakakatulong po ito para mapalakas po natin ang ating immune system upang labanan po ang mga infeksyon. Ang ilan po sa mga kailangan nating kainin ay ang broccoli, cauliflower, cabbage, at kailangan din po nating uminom ng turmeric tea. Samahan po natin ng 2 kutsarang honey. Napakaganda po ito na natural antibiotic. Napakaganda rin pong kumain tayo ng saging dahil nakakabuo po ito ng protective layer sa ating stomach upang maiwasan po natin ang pagsakit. Gamot din po ito sa ating stomach ulcer. At alam nyo rin po ba na ang pag-inom ng gatas dati po ay nirerekomenda ng mga doktor. Ngunit sa bagong pag-aaral po, ito po ay hindi na maaaring ibigay dahil ang gatas po ay merong mataas na content ng protein at calcium na hindi po pwedeng inumin ng taong may stomach ulcer dahil nakakapagpalala ito ng symptoms ng stomach ulcer. Importante din syempre ang pagkakaroon ng maayos na lifestyle dahil nakakatulong ito upang maiwasan ang pagkakaroon ng stomach ulcer. Kumain po tayo sa tamang oras. Huwag po tayong nagpapagutom. Nguyain po nating mabuti ang mga pagkain na ating kakainin. Umiwas din po tayo sa pag-inom ng alak. Umiwas din po tayo sa paninigarilyo. Kung maaari po ay limitahan po natin ang pagkain ng sobrang maaasim at sobrang maaanghang. Pati na rin po ang pag-inom ng mga inumin na mataas ang acid content. Alam niyo po na ang stomach ulcer ay hindi po basta-bastang sakit dahil kapag napabayaan po, pwede po itong mauwi sa malubhang karamdaman. At kung magkakaroon ang bawat isa sa atin ng proper food intakes at lifestyle, for sure malaki ang chance na maiwasan natin ang pagkakaroon ng stomach ulcer. Sana ay marami kayong natutunan sa naging discussion natin ngayong araw. Muli po, ako si Dr. Jason Sanchez, your integrative medicine doctor. See you again next week para sa iba pang very informative topics. Because natural is beautiful. Only here at Naturally Yours.
Don't switch your channel. We will be back after this break.
Ito ang tama at maling paggamit ng bleach kung gagamitin na panglinis sa bahay. Ihalo ang 1/4 cup ng bleach sa 1 galon na tubig. Iwasan na paghaluin ng bleach at ang mga produkto na may ammonia tulad ng panglinis ng salamin dahil makagagawa ito ng nakalalason na chloramine. Huwag haluan ng alcohol ang bleach dahil nakalilikha ito ng chloroform na makasasama sa kalusugan kapag nalanghap. Huwag din paghaluin ng bleach at asido dahil nakalilikha ito ng chlorine gas na kapag nalanghap ay makasasama sa baga. Tandaan na mahalaga ang kalinisan at kaalaman para maiwasan ang sakit. A reminder from UNTV, your public service channel. Mahina ang immune system ay kasama sa high-risk na grupo kapag nagkasakit ng COVID-19. Isang paraan para mapalakas ang immune system ay ang pagkain ng prutas, gulay at fruit crops. Ang patatas ay inirerekomenda ng National Nutrition Council dahil sa mataas na vitamin C nito na makatutulong magpalakas ng immune system. May taglay din itong zinc, vitamin B6 at isang uri ng alkaloids na mahalaga sa maayos na paggana ng immune system. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
I've been here for almost 3-4 years as a judge. And even as a judge, ako po ay talagang nabibless. Marami tayong mga Filipino composers that are so good. And buti na nabibigyan sila ng pagkakataon dito sa ASOC. No? To be able to have their songs sang, to have their songs listened by people. I continue to just encourage all the songwriters there. Write with your heart. Write with your experiences. Continue to support a Song of Praise Music Festival every Sunday, aso po, dito sa UNTV, 7 p.m.
We're back, but before we proceed, let's have some talk about babies. Why children suffer from gastric ulcer.
Good morning mga kasangbahay! I am Dr. Katrina Florcos Dacanay, your pediatrician for today. At ngayong araw, we will talk about gastric ulcers in children and teens. Tayong mga parents, maaga pa lang ay mahalagang malaman na natin kung mayroong ulcers ang ating mga anak para hindi ito lumala at para makaiwas tayo sa mga sakit na ito. Narito ang mga kailangan mong malaman tungkol sa gastric ulcers. Ang ulcer ay isang sore or sugat on the inner lining protecting the stomach or the upper part of the small intestine called the duodenum. Ang ulcer can also form on the lining of the esophagus. Ang ulcer, less common ito sa mga bata compared sa adults. However, ulcers can develop at any age, kaya dapat alam natin ang causes nito. Ulcers happen when the lining inside the stomach or the intestine becomes weak at nagiging prone ito sa damage dahil sa stomach acid. Sa mga bata, ang ulcer ay commonly caused by a bacteria called Helicobacter pylori, which enters the body through food and water that we eat. Yung H. pylori, nagpo-produce kasi ito ng mga substances na pwedeng makadamage sa lining ng tiyan. Other factors na dapat tandaan natin, pwedeng mag-cause ng ulcer kapag ang bata ay na-expose sa secondhand smoke, at para sa mga teenagers naman na umiinom at naninigarilyo, at risk din sila of developing gastric ulcers. May ibang mga bata na at risk din from developing gastric ulcers. Ito yung mga nakatira sa overcrowded conditions, pwedeng may factor din ang genes, at ang mga bata na regularly umiinom ng mga non-steroidal anti-inflammatory drugs tulad ng pain relievers na aspirin ay ibuprofen ay pwede ring may risk of developing ulcers. Ang common symptom of stomach ulcers in a child would include burning pain in the stomach na pabalik-balik, stomach ache na sumasakit kapag walang laman ng tiyan at nawawala bago siya kumain. Madalas din silang nakaka-experience ng pagduduwal, vomiting, madalas na parang may kabag or hangin sa tiyan, madalas wala din silang ganang kumain, may unexplained weight loss, at madalas ay feeling of hunger. Yung mga young children may not have the typical symptoms but may have abdominal pain and vomiting. Sa mga infants naman na may ulcers, they can be very fussy, irritable during and after feedings. Kung hindi maagapan, posibleng komplikasyon ng stomach ulcer sa bata ang bleeding, pagkabutas sa wall ng stomach at intestines, obstruction sa intestinal opening, at pwede rin itong mag-lead to stomach cancer. Paano nga ba natin maiiwasan ang ulcers in children? Preventing H. pylori can reduce your child's risk of ulcers. Kailangan maghugas lagi ng kamay at huwag kumain or iminom ng contaminated food or water. Iwasan din ang mga NSAIDs na gamot tulad ng aspirin at help your child to avoid coffee, tea, soft drinks at mga pagkain na may caffeine which can increase acid in the stomach and can make the ulcer worse. Tandaan po natin ang stomach and duodenal ulcers are open sores or sugat sa loob ng lining ng tiyan at bituka. Most ulcers are caused by infection with H. pylori bacteria at ang treatment includes antibiotics para gamutin ang H. pylori. Meron ding binibigay na medicines to block the production of stomach acids. Without the right treatment and prevention, children with ulcers may have serious complications like bleeding and perforation of the lining. But most children are cured with treatment. And that's it mga kasangbahay. Sana marami kayong natutunan sa araw na ito. As always, consult your pediatrician for your children's health. Thank you again for watching today's episode. I am Dr. Katrina Florcus Dacanay. You can follow me in my Facebook page and YouTube channel, Dr. Katrina Florcus. My Instagram and TikTok would be katrinamd.ph. I hope to see you again in our next episode.
Nagbabalik po ang Doctors on TV and of course kasama pa rin po natin si Dr. Frederick Leelin, isang gastroenterologist from Makati Medical Center. And this time kasama rin po natin si Miss Belinda Aquino na lumapit po sa ating programa dahil po sa suspected gastric problem niya and of course sa mga sintomas po na kanyang nararamdaman. And Miss Belinda, ano nga po ba yung mga nararamdaman niyo and ganong katagal na po ito?
Actually, matagal ko na siya nararamdaman, pero...
Like, gaano pong katagal? Mga ilang taon na po ba yan? Buwan?
Taon na po, pero hindi siya ganun kasakit pa.
Sa sikmura? Sa sikmura po ba yan?
Opo tapos yung after kumain, siguro mga 1 to 2 hours, maramdaman ko mahapdi na siya. Bali, 2019 siya dumadalas.
Okay, and bukod doon, may pangangasim ba na pakiramdam?
Opo, meron po.
Okay, so mula 2019 daw po ang kanyang sinisikmura siya and may kasama itong pangangasim. Okay, may feeling of acid ba? Nagsusuka na ba kayo ng acid? Hindi pa naman.
Hindi pa naman po. Pero kasi may sharp na kasi na may pain na.
Okay, so mas madalas po ito pagkatapos yung kumain. Yun ang na-mention nyo. Okay, and ito ba ay meron usually sa umaga, sa gabi, or pagkagising, meron ba kayong iba pang nararamdaman?
Usually po siya sa tanghali.
Sa tanghali. Kayo ba ay nalilipasan madalas ng gutom?
Opo, nalilipasan
Okay.
din po. Kasi po yung dahil sa trabaho ko.
Kamusta naman yung inyong diet? Meron mahilig ba kayo sa mga sodas? Okay, o kaya mahilig kayo magkape?
Mahilig din po akong magkape, pero higit sa lahat, yun nga pong energy drink, yung mga ganun. Kasi nga po, yung trabaho ko kasi puyatan.
I see. Okay, naku, good thing nakasama natin si Dr. Frederick Leelin, ano, para at least mas malinawan, no, kung ano ba yung condition mo, Miss Belinda. Okay, and with this, okay, Dr. Freddy, okay, so ito po, ano po ba tong actual case ni Miss Belinda Aquino?
Well, Belinda, you are how old again?
41.
Okay, so that's the first information that we usually look at, you know, the age of the patient, because that's wherein you're going to make a decision on whether you need to do an endoscopic exam.
I see.
That means, like we said earlier, taking a look inside the stomach. Sisilipin yung stomach. Usually, we offer to look inside the stomach for this kind of a problem, which we will call generally as dyspepsia. Ibig sabihin nun, lahat ng sinabi niya, nakakaramdam siya ng pagsakit ng tiyan, pangangasim, nalilipasan ng gutom, umiinom ng mga energy drinks. All of that can lead to the condition known as a dyspeptic stomach. Lahat yun, no? And we need to decide on whether we need to check the inside of the stomach for precisely maybe a gastric ulcer, which I said, dun mo lang pwedeng malaman pag sinilip mo eh.
Yeah.
So, the age is usually if they're above 50. Okay? This age range or that age limit, no, is not naman a absolute number. She's 41. Maybe she's saying that the symptoms, yung nararamdaman niya, are increasing in severity lately. Even if she's less than 50, no, which I said we only look inside pagkalampas na ng 50. 41 lang siya, we can still look inside
It
because
can be an indication na rin.
Yeah, it can be an indication.
Because of
na
her
rin.
presentation, Doc.
Because of her presentation, no? Sometimes also, even if they're less than 50, you can also look inside the stomach simply so that you can give them some, what we call peace of mind. Some of them kasi, and I think in this particular case, that's how it turned out to be. She was very anxious about what she was feeling. She was, getting so disturbed by it. Sometimes when you look inside the stomach and then you tell them that everything is okay or they can see for themselves, naturally they get better. Of course, we're going to treat her also depending on what we see inside. Kung anong masisilip namin sa loob. Secondly, what I look for, aside from the age, is what we call alarm symptoms.
Alarm symptoms.
Yes.
Okay.
These are basically unexplained weight loss, yung nabawasan ng timbang ng walang ginagawa, not taking anything, not doing anything. Someone will tell you, hey, mukhang ang dami mong na-lose na weight, di ba?
Yeah.
Usually yon ang ibig sabihin nun, mukha kang may sakit eh, di ba? So that's an indication to look inside. Of course, if blood is coming out from the gut, through the mouth or through the anus, no, which you can get when you have an ulceration in the stomach, that's an alarm symptom. Intractable pain. Ang ibig sabihin ng intractable is di masugpo-sugpo na sakit ng tiyan. Yung enough sometimes to sometimes visit the emergency room, which she might have done in the past, over the past 2 years, which is when it started. Di ba? Yung sakit na ganon. And then, lastly, pag meron kaming nakapa when we do a physical exam. So, it's both history and physical exam. I-examinin namin yung stomach through, with palpation. Pag meron kaming naramdaman na matigas, may parang bukol, may parang sakit na sobra, ganyan, that's a reason for us to take a look inside the stomach.
Okay, so having mentioned all those reasons, so Miss Belinda here is a good candidate for endoscopy.
Right.
Okay, and yun nga po with that, no? Okay, so dahil ito nga si Miss Belinda ay tinutulungan ng ating programa, okay, katuwang ang Makati Medical Center, and of course through Dr. Frederick Leelin, ang ating pong patient ay nag-undergo ng endoscopy. And Doc, can you explain to our viewers paano ba ginagawa tong endoscopy, and is there a special preparation prior po dun sa procedure itself?
There is, but the preparation is not what I would call special or ano. All you have to do, is don't eat breakfast in the morning.
Okay.
And show up. The second thing that you have to do is to show
Yeah.
up, right? When you get there, we have a unit which is staffed specifically for this type of procedure. We have nurses, we have a greeting staff, we have technicians, we have orderlies, all complete, everything in that center.
Basically, they are all well-trained, okay?
That's correct.
Okay.
When you get there, you're going to be admitted, okay? You're going to be changed into a gown. Then you will be made to lie down on a gurney or a hospital bed. And most often, you will get an IV insertion through which the sedation is going to be given.
Okay.
When we do this examination, we give the patient an anesthetic, pampatulog, pampamanhid. The pampamanhid is a spray sa mouth, which is what Belinda underwent.
Yeah.
No? It will anesthetize the throat. And through the IV, we will inject her with medicines that will, in
Make
not
her
so many
fall.
words, knock her out. Diba?
Okay. And how long will that take ba natulog ba ang patient po? Ganong katagal ba yung procedure, Doc?
The endoscopic exam, on average, not to brag or to be, can be as short as 15 minutes, sometimes less. Some GI specialists can do it fast. Some do it at a certain pace, but average 15 minutes is long enough. Of course, there will be times now when we need to do more inside. Let's say we have to cut, cauterize, inject. Kailangan gawin yon. Test or do. It can sometimes last 30 minutes or more. Okay? But while this is all being done, the patient is usually sedated and then they don't feel anything.
I see.
In a sense, it's painless.
So basically, is this an outpatient procedure?
Yes, you come in there, you get sedated, you undergo the procedure, you wake up from the procedure, and then you go home same day. Let's give an example. You come in at around 10, you're able to go home at around 3 p.m.
Okay. So, hindi naman nakakatakot ang procedure. Okay. So, sa mga pasyente, sa mga ating mga kasambahay po na may ganitong, how do I say it, agam-agam kung kayo ba ay may gastric ulcer o wala. Okay. So, ito nga po katulad na mention kanina ni Dr. Leelin, ay malalaman lamang po pag talagang sinilip. Okay. So, ito nakita natin, narinig natin mula kay Doc na hindi naman ito nakakatakot na procedure. Okay. And with what happened kay Miss Belinda, can we share to our viewers po kung ano po yung mga naging findings during the endoscopic exam?
I've done a lot kasi, so I'm just trying to remember na. Basically, you know what? Amazingly, I didn't see anything really in the endoscopic exam. The esophagus, which is the first part, the stomach and the small intestine, had a little bit of redness. We call that, if the area is the gastric area, we call it gastritis.
Okay. May pamamaga po.
May pamamaga, pero very minimal. If I were to associate what she was feeling, kung ano yung nararamdaman niya, dun sa nakita ko sa loob, hindi sila tugma. Ito yung nararamdaman niya, ang nakita ko sa loob, very minimal disease.
Very minimal.
That still is a good result. That still is
okay.
because you don't want to see at any point severe disease.
Yeah.
So,
and at least mas may improve niya yung lifestyle niya, and then and he would not resort to having severe gastric ulcers na, 'di ba?
That's correct. And it will be now mostly reassurance. You just reassure them that we looked inside, we didn't see much. Okay? Lastly, I'd like to comment also or to say, there's also something that we do on a regular basis when we do the gastroscopy. We are able to test the patient for a bacteria. The name of the bacteria is Helicobacter pylori. We test that because sometimes the reason why people have acidity in the stomach or acid ulcers is because they are harboring that bacteria. Where do you get that? You get that because you live in the Philippines. It's here, it's everywhere, it's in the food that we eat, the air that we breathe. it's everywhere. So that can be a factor as to why people develop gastric ulcers.
Pero Doc, if that's the case, how come sa iba nagmamanifest yun and then yung iba, despite being exposed to Helicobacter pylori and hindi nagkakaroon ng onset ng disease kahit may exposure? Should it be the immune system or?
There are a lot of factors why, and you already mentioned the word. It's basically how much you're exposed to it. It's related, and I'll say this, that we're a third world country.
Yeah.
Diba? That's a situation, we have to accept it. That's the reason why we have it here. I'm not saying that we're dirty or we're not clean, but our level, our economic status is third world. So the bacteria is present in our surroundings.
Okay, so basically it's just around.
Yes.
Okay.
So the important thing is to test it, which we did for her.
How did it turn out?
She was negative for it.
Okay,
so
that's good.
The treatment, however, on the other hand, will be very simple din naman. It's just you have to take some medicines and 100%, 99 to 100%, it will be eradicated.
But that management will take for how long, Doc?
Very short, maybe a week or 2 weeks.
Okay. So basically manageable naman,
Yes.
Doc. And ito, kanina we were talking about endoscopy. I would just like to ask, Miss Belinda, how was your experience nung nag-endoscopic exam ka? Was it painful or anything to share with our viewers?
Pinatulog lang po talaga nila ako. Actually, okay po kasi inasikaso akong maigi.
Oh, you have to be
Opo.
thankful to the whole staff and di ba? You're very fortunate, at least hindi pa pala hindi ganun yung condition mo, okay? So you actually the procedure actually yielded a good result, as per Dr. Leelin. And Doc, paano dun sa mga cases ng iba na talagang may gastric ulcer and how severe can it be ba? And how can we manage that? Para po dun sa kaalaman ng ating mga viewers na nag-aalala kasi na-diagnose sila ng gastric ulcer.
Well, there's a severity of how bad the disease can be. It can be what like Belinda here has, pamumula, which we call gastritis, to the end of that, which is a gastric ulcer that bleeds. No? So it's very wide as far as the severity is concerned. But the treatment is usually just very straightforward. You just have to control the acid secretion. The treatment of that is to take medications that block the acid being produced inside the stomach. And when you achieve that over the course of not in 1 day or in 2 days, it might require 7 days to 2 weeks. In fact, the treatment is usually given for 6 to 8 weeks. And the reason for that is pag sinusuppress mo yung acid sa stomach, it does it in a recruitment style. Ibig sabihin, on the first day, the first part of the stomach, the acid will be suppressed.
Okay.
On the second day, more than the first part and then the second part. The third day, like a recruitment type of...
So basically, inaalalayan yung may mga sugat na habang nag-heal and then while kinokontrol yung acid production. Is that correct, Doc?
That's correct.
Okay. And sa case po niya na, okay, so hindi na nag-advise ng ganung management being negative for gastric ulcer. However, for her gastritis, what was given to her?
Like I said, we gave her first reassurance.
Reassurance.
That's
it.
That's vital, no? Not really it. It's very vital. And I opted to treat her with a probiotic.
Yeah.
I felt that her gut needed just a reset, together with the reassurance that I was talking about. And then we asked her to follow up and then see how she's doing with everything like that, no? We can sometimes also shift and give her the medicines that I'm talking about. They're basically called antacids. From the word anti-acid, contra dun sa acid, di ba? So we can shift to that sometimes if I feel that she needs it. But now I think it's a lot of reassurance and a little medication for her.
I see.
Now, as far as the lifestyle is concerned, which is the other thing that I mentioned about the factors that weaken the resistance or the protection of the stomach, here comes in what we call triggers. And what are those? Caffeine is notorious, milk and milk products, soft drinks, smoking, alcohol intake, spicy foods, and sometimes taking a lot of chocolates have been notorious to cause the weakening of the lining of the stomach, producing the gastritis or the gastric ulcers. So we also, in tandem, give them advice about their lifestyle. Try
Okay.
to lessen these things, if not totally eliminate, no? Or if what I mentioned, none of those are any of her triggers, and she has an individual trigger. She notices that when she takes tomato-based foods, these are very
Yeah.
popular. When they take very sour foods, these are also notorious. If they notice that those are their triggers, then it's just practical that you stay away from them. Or realize na when you get symptoms of dyspepsia, it's basically just because you took those triggers.
Okay, so those were a lot, Doc, no? So basically, it all boils down to lifestyle change. Okay, lifestyle
Lifestyle change.
modification. And Belinda, are you ready na ba? Kasi ang dami niya na-mention. So basically, it's avoidance lang ng mga sinabi ni Dr. Freddy. Okay, so now you really have to be compliant na mention na lahat ng mga bawal. But I know it's a challenge kasi you mentioned that you would have to be up and you should be drinking this like mga energy preparations, pero syempre para sa health mo yan. You would have to follow talaga yung advice ni Dr. Leelin.
That basically falls under the factor called the stress. No?
Stress.
Which is everywhere now. I mean,
Yeah,
we live in a stressful situation now. We're under still the pandemic of COVID, right?
Yeah.
Everyone now is under stress. So it's really stress management as well, how you deal with the day-to-day living that you have to do in order to do your work, support your family, and lead a healthy lifestyle. Let me just say, as far as the COVID is concerned about taking a look inside the stomach, the only requirement nowadays is that you have a booster. You can undergo the procedure as long as you can show that you've been boosted. There's no other requirement.
Okay, so very basic, So yun lang ang kailangan, COVID vaccination booster.
Salamat po sa Makati Medical Center. Saka po sa tulong din po ni Doc kasi nalaman ko po ano po talaga yung reason kung bakit meron akong ganun sakit. Sa pag-asikaso po talaga.
So with that, thank you for those information. Thank you, Ms. Belinda. And sa inyo po mga kasambahay, please stay tuned. We will be right back after the short break.
Ang tama at maling paggamit ng alcohol bilang disinfectant. Karaniwang ginagamit na disinfectant ang alcohol kung hindi agad makapaghuhugas ng kamay. Inirekomenda ng DOH ang paggamit ng 70% alcohol. Hindi inirekomenda ang mas mataas na percentage dahil kailangan ang sapat na dami ng tubig para makapatay ng mikrobyo. Ang methanol at ibang uri ng alcohol na ginagamit sa industriya ay hindi rin inirekomenda dahil makasasama ito sa kalusugan. Ang alak o alcohol beverages naman ay hindi epektibo bilang disinfectant dahil 40% lang ang taglay nito. Huwag haluan ng bleach ang alcohol dahil nakakalikha ito ng kemikal na kapag nalanghap ay makasasama sa kalusugan. A reminder from UNTV, your public service channel. Mga pagkain na makatutulong magpalakas ng immune system, kamote at talbos ng kamote. Ayon sa WHO, mas madaling kapitan ng COVID-19 ng taong mahina ang immune system. Kaya payo ng DOH, kumain ng prutas, gulay at root crops para mapalakas ang immune system. Ang kamote at ang talbos nito ay dalawa sa mga inirekomendang pagkain ng National Nutrition Council. Ang kamote ay isa sa mga pagkain na may pinakamataas na vitamin A. Ang vitamin A ay nakatutulong mapalakas ang immune system, labanan ng impeksyon at para maging malusog ang respiratory system. Ang kalahating tasa o 100 grams ng kamote ay sapat para mapunan ang kailangan na vitamin A ng katawan sa isang araw. Ang talbos ng kamote naman ay nagtataglay ng iron at polyphenols na makatutulong laban sa impeksyon. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Tinulungan ng UNTV News and Rescue Team ang isang 62 anyos na Amerikano na nahulog sa higaan sa Butuan City. Nagtamo ng posibleng bali sa balakang ang matanda. Matapos malapatan ng first aid ay agad na dinala ang biktima sa ospital.
Kapag ang pasyente ay nahulog at nagtamo ng bali sa katawan, obserbahan ng pasyente at i-assess. Pwede po nating sabihin sa pasyente na galawin ang kanyang mga kamay at ang kanyang mga paa para malaman po natin kung may damage sa kanyang spinal cord. Para maiwasan po ang further damage or injury ng pasyente, huwag po natin itong gagalawin. Hayaan po natin sa posisyong natagpuan natin at tumawag po tayo ng ambulansya at dalhin sa pinakamalapit na ospital.
Ito ang serbisyong hatid ng UNTV News and Rescue. When we take off, you get a fresh overview of the news. From city issues to countryside stories, we tell you about celebrations and accounts of destruction. With drones, we give you not just visual narratives from a whole new perspective, but service on a higher altitude. This is our advocacy at UNTV Drone Journalism.
Nagbabalik po ang Doctors on TV and natunghayan niyo po ang ating naging talakayan tungkol po sa gastric ulcer. But of course, I'm still here with Dr. Frederick Leelin. And Doc Freddy, kanina napag-usapan natin basically, iwas stress, lifestyle modification. So, hindi naman, well, dapat naman talaga lagi tayong healthy, but gastric ulcer can really be managed naman. So, kailangan lang talaga lagi nagpapacheck sa doctors and maging compliant. Sumunod po tayo sa payo ng ating mga doktor. And ito, Doc, ano po ba yung mga meron tayo dito na like mga diagnostic procedures here sa Makati Med with regards to gastric ulcer diagnosis?
Well, our center, known as the Endoscopic and Liver Center, okay, has a full battery of consultants, staff, nurses, technicians that can take care of both upper and lower endoscopic procedures, as well as our liver center, which takes care of all problems associated with the liver. So we have a unit, which is, as I said, staffed. And we would like to say to all of the would-be patients out there, if they want, they can consult. They can just call the trunk line of Makati Med, and we have a full staff also of operators that will triage you as to what needs you need and how you can get yourself scheduled, how you can get yourself consulted with and diagnosed, as well as eventually treated, so that you can achieve what you were saying, a healthy lifestyle.
Okay, so basically, they just have to contact Makati Medical Center. And thank you very much, Doctor, for your generous inputs. And at this time, do you have like final words for our viewers, especially those who have been diagnosed with gastric ulcer? Kasi syempre, iba dyan kinakabahan na eh. And I mean, what would you want to share with them?
Well, maybe as a parting word, a lot of patients that I see, when I offer to them the endoscopic procedure, they get very anxious about it, and they complain that, why are we going to do it right away? And eventually, when they do undergo it, they realized that it wasn't that difficult, it wasn't that scary, it wasn't that dangerous. Okay, there's just that myth that, especially if I may segue, to the lower gastrointestinal tract, when you do a colonoscopy, there's a lot of misgivings about it, and maybe we can have a segment later on about the lower tract, the colonoscopy. That would be interesting as well, so that people can be more educated about the need to undergo that examination, because it's not that difficult, it's not that scary. Try not to be so influenced by what you hear from other people. We can explain it to you at our center, and you can undergo it there. That's my appeal to everybody.
Okay, very well said, Doc. And with that, thank you very much again, Dr. Frederick Leelin. Again, thank you very much, Dr. Frederick Leelin, a gastroenterologist from Makati Medical Center. Please stay tuned. We will be right back after this short break.
Tulad ng ibang karamdaman, dapat nakahanda tayo sakaling magkasakit ng COVID-19. Ito ang mga dapat isama sa COVID-19 home kit: thermometer, oximeter, pain relief medicine tulad ng paracetamol, gamot para sa dehydration, disposable face masks, sabon at sanitizer, disinfectant spray, disposable gloves. Para sa iba pang mahalagang impormasyon, manood ng Lifesaver dito sa UNTV, your public service channel.
Ang mga mahina ang immune system ay kasama sa high-risk na grupo kapag nagkasakit ng COVID-19. Isang paraan para mapalakas ang immune system ay ang pagkain ng prutas, gulay at fruit crops. Ang patatas ay inirerekomenda ng National Nutrition Council dahil sa mataas na vitamin C nito na makatutulong magpalakas ng immune system. May taglay din itong zinc, vitamin B6 at isang uri ng alkaloids na mahalaga sa maayos na paggana ng immune system. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Naturally, in human norms and standards, those who are weak are despised. But in the Bible, those who are weak are given honor.
Best solution palagi is before you do anything, kneel down and pray. Ask for guidance kung ano yung pwede mong gawin sa buhay.
Alam niyo po, lahat under the sun na maiisip ng tao na gusto niyang malaman, mas makakakuha siya ng magandang perspective from the Bible.
God knows our infirmities. God knows that we are weak. We will sin whoever we are. But the question is not our sins, but our will to do His will. God will always have that compassion. For us to go to heaven, we have first to acknowledge the existence of God. That is the first and foremost thing that we have to do.
Ang isipin natin, God knows best. Sa Kanya ka magtiwala.
Minus God, then everything will be in vain. But with God, every problem will be solved.
There you have have it mga kasambahay, sana po ay marami kayong napulot sa ating tinalakay tungkol sa gastric ulcer. And syempre, we're inviting you to please like and follow our Facebook page, Doctors on TV, and like and subscribe to our YouTube channel at Doctors on TV. And before we end, we would like to greet Dr. Arvin Gamboa, Dr. Marlon Suarez, Dr. Ryan Raymond Bautista, Nurse Jomiel Bacani, Nurse Ray Cabelin, Nurse Dryden Rasho. Muli po, maraming salamat sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Be safe and stay healthy mga kasangbahay. See you again for another episode next week. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-423133 or 028-824-5217 or 028-813-0320. Organic Acai. Support your health with 100% organic superfood supplement. Organic Acai Premium Blend and Acai Freeze-Dried Capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic Acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sarah Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.